a commercial. All right, we are back. She's analyzing my reaction to bee stings. We're going to talk about bees and pollen and honey and things like that as well. But with us this morning is Alice Holt. She's a doctor. She's over at the Asthma, Sinus, and Allergy program at Vanderbilt. And she's very good at kind of spelling out for you the issue with allergies. Real quick, before we get to some phone calls, and the lines are open, 737-7587. You talked about the nasal stuff, which, again, I know also there's some of the saline sprays.
Yes.
You said the neti pot. Saline, and then talk about...
Whichever you're going to do.
Is saline okay?
Yes, absolutely.
Okay.
Because some people really don't like squirting things up their nose.
And then having it come out one nostril.
Right. So I say sort of the baby step is to start with the pre-canned in the shower, simply saline. I have no stock in any of these things. And do it in the shower. And you're just trying to gently rinse gook out.
Okay.
So that's the first thing. The second thing is
neosynephrine and some of those others, Afrin, which that's like hitting your nose with a pipe cleaner. I mean, it works. When you're stuffed up and you shoot that in there, I mean, it really, really works.
It
but
does.
you only, you only want to use it, what, one day?
Yes, if that.
If that.
And very, very limited times will I recommend it to a patient because the potential for addiction is so high. The reason it's addictive is because it works so well. What happens, you know, we were talking about these mast cell granules and how they contain chemicals that make your vessels swell, and that vessel swelling and leakage is where the congestion comes from. How Afrin works is by making those vessels constrict. Yeah. But what happens is that over a few hours, the Afrin wears off, and then you get the swelling again, and you can have what's called rebound congestion. And so then people need to use it again.
Could it swell even more than what it was?
The congestion can rebound even worse, yes.
Yes. Well, my friend who did it, and he was using it, I don't know why he didn't get the note on this, for several weeks. And when the doctor finally said, you're addicted, and when he came off it, the reaction literally shut down his nose. And he couldn't breathe through his nose. It came back eventually. Right. But he was miserable for several weeks.
And that's why it's very rare that I recommend it for a patient.
You. Yeah, I have some at home, and I'll use it in very rare instances one time. Right. And that's it. Yeah. Hey, we've got some calls. Let's go to Ann. Ann, good morning.
Good morning.
Hi, Ann.
I have a question, and then I have a comment for you, Nick.
Sure.
I have a strange allergy. I'm allergic to poinsettia plants. And by allergic, I mean I have to live with an EpiPen. My question is, people plant them in their yards and they grow during the spring and the summer, which requires me to carry that EpiPen year round. Most people assume they're only out during the winter months, and they are in every hospital, church, school, you name it. If there's a high population, there is a red Christmas flower that prevents me from going 50 feet or 100 feet near that.
Is it really? It's the scent. It's not if you touch it. If you just smell it. If you smell it, it makes you sick.
It's on the root of the plant. It has nothing to do, from what I understand, with what even grows above.
So how do you get exposed to it?
It's airborne. It is somehow related to latex. I really don't understand it, but I have a sister. I have 5 sisters, and there are 2 of us that have this allergy. Through the years, we've been tested. Through the years, we've asked, is there a shot that we can take? And through the years, we've been told, no, you've got to carry this stupid EpiPen. And it's gotten worse and worse through the years because it's become more, the plants have gotten bigger and people grow them in their yards.
Okay, I'll let her address that. And then what's your other question real quick for me, or did you have anything else?
Yes, East Nashville is heavily populated with urban gardeners, and we are doing our best for the bee population.
Oh, good.
So far this spring, I've been stung by 2 of my friendly little boogers. So feel confident in the fact that we in East Nashville are doing our best
You are awesome, Anne. And Anne, of all people, she's smart and she knows how important bees are. But I've never heard of a poinsettia allergy, but I guess you can be allergic to anything. Does that even ring a bell with you, or what do you think?
So what I would ask, Anne, if you were in my clinic, is I would ask what really happened the last time you were exposed to a poinsettia, and what was that exposure, just like what you were asking of how do you become exposed to it, if it's the roots.
Yeah.
There are some cross-reactivities with certain plants or certain produce and latex. Luckily, latex is not used very often in the healthcare setting anymore, but there can be some overlap there. But I'd be very curious to hear what sort of reaction she had and what sort of reaction her sister had. There are some allergy mimickers, such as chronic, meaning the symptoms have gone on intermittently for more than 6 weeks. Idiopathic, meaning we don't know what causes it. Urticaria, meaning hives. So chronic idiopathic urticaria. And I see these patients all the time, and they come in and they're like, Dr. Hoyt, I can't figure out what I'm allergic to, but I keep having these hives and sometimes facial swelling for no apparent reason. And that's one of our allergy mimickers. And so that's something that I would try as much as possible to rule out with her, because this sounds like it's really affecting your life. And it's an allergist's job to help these things not affect your life.
So, and with her, you could, like any allergy, treat her symptoms for the poinsettia thing, I suppose. But if it's that serious that she needs an EpiPen, you need to find a way, if you can isolate what she's allergic to get her so that her body no longer has that reaction, kind of to cure it. So
generally, inhaling will not result in anaphylaxis. Like generally, you won't inhale birch pollen and have anaphylaxis. There are studies in mice who have been given a peanut allergy in the lab, and then they put peanut protein into their nares, and then they do develop systemic symptoms, meaning all over symptoms consistent with anaphylaxis.
But usually you'd have to ingest it somehow.
Exactly. Usually you'd have to ingest it.
And anaphylaxis, just so folks know, is when you start swelling shut, right?
Right. Anaphylaxis is when you have a system-wide reaction to a local action. So if you get stung by a bee,
which has happened to me,
which has happened to you, and then you have symptoms more than just in this location where you were stung. So if you have all over hives, if you have trouble breathing, if you have swelling, that's a system-wide reaction to a local action, and that is anaphylaxis.
Okay, and for that, when I got stung, and it was rare, but I've been stung lots of times. Why would it someone, and she talked about bees, and why did I have a reaction to a bee sting when I had been stung dozens of times before?
We think that in a way venom allergy, venoms meaning bee venom, wasp venom, that those venom allergies are similar to drug allergies. Drug allergies tend to happen in patients after they've been exposed to the drug. Sometimes not. There's so much about allergy we don't yet understand. But so in theory, because you've been exposed and stung so many times to that venom, your body has developed this allergic antibody to the venom, and then when that venom found that allergic antibody, it sent your mast cells into degranulation mode.
I would think it would be the other way around. You've been stung so many times, your body's used to it, and it recognizes it, and it doesn't attack itself.
I agree. That's why allergy doesn't make sense.
That's what you said. There's all these unanswered questions for that.
Because then the flip side of that is, well, if exposure can result in allergic reactions, why are we now giving babies peanut?
Right. Or when you do allergy treatments and you've determined what it is through the needle pricks, and then you find out what it is, and then you start exposing persons with shots to small amount.
Right. So induction of tolerance is something we can do, and that's what we're doing with those little babies who are at risk for peanut allergy, giving them peanut early to convince their immune systems to tolerate peanut. And so by giving you low doses, like I could desensitize you to venom by giving you
small
low
doses of bee sting stuff.
And so we think it has something to do with low doses gradually over time, as opposed to simply overwhelming you with the amount of venom that would be in that bee sting.
But I've been stung since then and have not had a reaction.
I know. But it makes me very nervous because we know that venom allergy can be fatal, very much so. And so because we have a treatment that works very, very well, reduces fatalities, reduces systemic responses, that's why any patient who has a good story for anaphylaxis, systemic action to local action, that's why I strongly recommend, and all of our academies strongly recommend, venom immunotherapy, because it does kill people.
Could I come in and be tested to see if I'm allergic to venom?
Yes.
So what if it came back negative?
Then I would do blood work.
Okay, but if you were to find I'm not allergic anymore, even though you know I had anaphylactic once, but if you tested me and I'm no longer allergic,
then because of such a strong history, then I would say based on your history that we would still do shots for you.
Just because of one time? Huh,
that's all you need, because as you're pointing out, like, I'd never had it before. Why now?
Well, it's because
Why
of the
that
stress.
sting?
It was the stress.
There are factors that lower your threshold to have an allergic reaction. That's true.
So maybe, but I understand what you're saying. Why play it safe rather than sorry? And that's a very good point. Let's go to Dawn. Dawn, good morning.
Oh, good morning.
Hello, Dawn.
Hi.
Hi. I'm calling, and you guys were just touching on the subject of some years I can have just awful allergies where there isn't enough tissues in the whole world to compensate for the, what's coming out of my nose. And then I can go for 3 or 4 years with no symptoms whatsoever. Is there something in my environment changing, or is it something in my body? How come that happens?
When are your symptoms? Are they usually springtime, or are they usually fall? When they happen? Kind of
usually
anytime?
It's the spring.
Okay.
Spring into summer.
Okay.
Thanks.
So what could be going on? There are different amounts of pollens released. Some years are better or worse than others. And so that could be what's going on with you, and it could also be what else is going on in your life. Are you exposed more to the pollens? Are you outside more? Are you inside more? Have you been sick 1 year and you've been on antibiotics, and maybe that's changed your immune system a little bit, or changed some of those good bacteria, and so maybe now you're a little bit more prone to having more symptoms. We do hear this, and this is why it's really helpful to come see us so we can get you allergy tested to really help identify what it is that you're having allergic reactions to, so that then we can stop you from having the symptoms before they even start.
Sure. And another thing too about the bee stings, it was about 5 years ago my husband had an incident where he was out in the backyard clearing out some brush and ran into just some bees that I think they lived in the ground.
It's probably yellow jackets.
Yellow jackets?
Yeah.
Right. And I was gone, and when I came home, my husband was on the couch trying to get to the cell phone to call someone, but he was in anaphylactic shock, and his throat was swollen to the point where he couldn't talk and couldn't breathe, basically. And I just making a comment on how quickly and how dangerous that could be. I called the ambulance, and of course they gave him the shot, and but he had to go and be treated in the hospital for the breathing issues. So,
has he seen an allergist?
But no, we haven't. I didn't know there was something out there like that you could do those shots. So what we did was bought him a bee suit for a while.
Yeah.
But he does have his EpiPen that he carries too. But
the EpiPen basically has it's a smaller dose of what you're going to get if you go to the emergency room, right? Is that?
So no, not necessarily. It's the same dose.
Same dose, and it's what is it? It's
epinephrine.
Epinephrine. Okay.
Epinephrine. And it comes in various forms: EpiPen, AuVQ, different devices, but they all have the same medication called epinephrine. And epinephrine actually stops this reaction.
Yeah.
Benadryl, antihistamines, they won't stop this reaction. They'll start to calm some of the symptoms, but the only medication that's actually going to stop a severe allergic reaction, anaphylaxis, is epinephrine.
Oh, okay. So the Benadryl, if you pop those, then that will stop just the runny nose or something, but it won't, the itching. So if you get stung by a bee and you take 2 Benadryl, it's not going to make a difference if you're allergic to it.
Right. It won't stop you from having a systemic reaction.
Interesting. The needles on those EpiPens, because you see the little things, you're like, oh man, they're like that small.
Yeah.
They're nothing to it. And I've never had to really nail myself with one. But when you get one, you get a little practice kit.
Yes.
And you get to practice hitting yourself in the leg.
Yes.
I have a lot of friends that were hoping to be able to nail me with that thing.
Yes.
But never happened. And yeah, it's on the
And it can go through clothes.
And it's usually that you want to go to the thigh?
Yes, upper outer thigh through the clothes. You do not need to pull down pants or anything. The
Goes
needle
right
will
through.
go right through.
Yeah.
Depending on your device, you hold it down for 3 seconds, 5 seconds.
Have they gone down in price? I know they had gone up, and then remember there was that big controversy over raising the prices, and then some competition came out.
Right.
Do you have any idea how much an EpiPen costs these days?
Yes, so you can actually get a generic EpiPen for about $100, a 2-pack of a generic,
2-pack, $50
generic
each.
epinephrine auto-injector for about $100, and that's cash without any sort of insurance. With insurance, there are some programs where you can have a no copay. There are some programs where it costs you $25.
Yeah.
So they are more affordable now.
Good.
The court of public opinion matters.
Yeah, you're so right, and it made a difference because it was getting up there. And by the way, they'll last about how long? They say you're supposed to watch the liquid color, and if it doesn't change right, what do you think? It's good for a year?
So the expiration date is the answer I'm supposed to say, but I never tell my patients to throw away an EpiPen that has expired. You're exactly right. The window can tell you if it's discolored, then don't use it. But I would rather a patient have an expired epinephrine auto-injector and use it in an emergency situation than nothing.
But I'm just saying, if you're going to go buy new ones to replace it, you would maybe, if you don't mind spending the money, to get a new one, what, every year or so?
Every year. I would definitely try to have an up-to-date one, but just don't toss the other ones.
That's what I did.
Studies have shown that if they're taken care of, they can last a few years longer than that expiration date.
Gotcha.
But that means not leaving it in the car, not exposing it to extreme temperatures. These should be at room temperature, not in the refrigerator, not in the freezer, not in your car, not in the 90, 100 degree weather. So take good care of them, because you don't ever want to be in a situation where you need one and you don't have it.
And they're not cheap. So we'll take, even though they've gotten better on price. Let's take a break. When we come back, more of your calls and questions if you want. We're talking about seasonal allergies, 737-7587 with a good doctor. We'll be back right after this.
The Storm 5